Good friends with Dr. Jindal for a number of years. We were fellows together at Mount Sinai in New York and trained together and stayed in touch and good friends. And he asked me to come give him a hand on this medical trip. So I was very excited and looking forward to an interesting and hopefully successful outcome. I'm sure it'll be successful. Actually, I have had some experience practicing medicine and surgery. I've had a time in South Africa, and also I did a liver transplant with a friend of mine in Israel. So I have a little experience in operating in other countries.
What are some of the things that the ordinary man can do in order to prevent, as Dr. Jindal was speaking about, prevent this disease from spreading, or diseases related to the kidney?
The most common causes of kidney failure in the world are hypertension and diabetes. Largely, part of that is genetic. Some people just have it in their gene, they're going to be hypertensive. But there's also a lot of lifestyle issues. Dr. Jindal already mentioned one of the important features of the disease is obesity. We now think of people not so much in their height and weight, but we think of their body mass index. So we talk about a BMI, and most in the United States is a very large problem of obesity. It's almost an endemic problem. Along with that, we're seeing a great rise in diabetes and hypertension. So we know that there's a strong association between diabetes, hypertension, and obesity. When your BMI gets above 30, when it gets into the 30-35 range, and when you're 35, you're a fairly plump person, your risk of diabetes and hypertension goes up. Concomitantly, your risk of renal failure goes way up. So if you can sort of stave off, if you have a genetic propensity, but you stay thin and you try to stay as healthy as possible, then the likelihood of you developing these problems subsequently or concomitantly with that, the renal failure, you can pretty much you're sort of assuring yourself that you'll be okay. The business of hypertension, along with that, a little bit is the stress of environment and environmental stressors, economic issues, social issues, and what have you. And those are a little bit harder to control for. I mean, you can control what you put in your mouth, but you can't always control if you lose your job or if somebody in your family dies, and those kinds of things can also contribute to hypertension. It would be great if we could get everybody to meditate or pray and try to be more mentally calm, but I think that's a harder thing to educate people to. But having said that, as Dr. Jindal has already pointed out, education is extremely important. And I think one of the things that can be used from this surgical experience is that this surgical experience is a very dramatic, big, splashy thing to do in a developing country. And I think it allows people to feel a lot more confidence in their government and in the sponsors and in the people that are doing it, so that they can say, yes, we are participating in the first world. Even though we may be developing, we can do these complex things here and show that that can be successful. So I don't see doing this as an either or. We should be stopping malaria, or we should be curing diarrheal diseases. Yes, we should be doing that, but we should also be doing some of these first world kind of things in this setting. And I think the drama adds to the impact of the education. If you catch people's attention with this dramatic event, doing the first kidney transplant, bringing this kind of thing that hadn't been done before to this area, it gets people to think, oh yes, we do have a problem. End-stage renal disease is a problem. Heretofore, I bet if we canvassed the community, there wouldn't be that many, because people don't get a chance to be treated. They will just go and die, and they're sitting quietly in their town, and they sort of fade away. So now that it's been brought to the fore with this dramatic event, if you will. It allows greater impact and a greater learning experience for anybody that's the average citizen that's going to hear about this. They're going to look at themselves and reflect, oh, maybe I'm a little overweight, maybe I should not be so stressed out. And I think that the message, the educational component of this project will be that much more valuable.
What's your motivation? And secondly, Dr. Jindal also said he'd like to do many more surgeries per year. What's your level of cooperation there? Should you be called upon again?
My motivation is, I guess it's the reason that I went into became a physician and a surgeon, is that I get a lot of satisfaction out of helping people, saving lives. And in this situation, it is clearly life-saving. Dr. Jindal writes in his book that this young man only had enough money for a couple of dialysis, and then we know what if you don't get dialysis, you'll be dead in a few weeks. So yes, this was a life-saving thing, and that gives me a tremendous satisfaction that I can help somebody, prolong their life and improve their quality of life. And I'm very committed to working with Jindal, and we look forward to coming back for other events.
What gives you this kind of motivation? Why do you keep doing this?